Excellent.
And you know what happens is that people's risk for developing colorectal polyps can really be assessed at the initial colonoscopy. And then we can guide patients as to what the best approach is to have further testing down the line, if necessary, to help keep their risk of colorectal cancer in check.
Yeah, right. Now, we've talked about risk factors a little bit, and we know across the board the recommendation is age 50.
Right.
Assuming their health status, they can manage that. But what are some of the risk factors that might prompt someone to have it done sooner?
Well, first of all, a lot of people believe that they never need a colonoscopy before age 50 under any circumstance, and that's not the case.
True.
Sometimes patients develop such warning signs as rectal bleeding that's persistent, changes in their bowel habits, other factors that are abnormal for them can often lead a gastroenterologist to perform a colonoscopy earlier than 50 years of age. Also, if a patient has a first-degree relative, a mother, a father, a brother, a sister, with colorectal polyps or colorectal cancer in the family. Oftentimes those screenings are done at 40 years of age or 10 years before the person who developed the cancer, who was the relative, actually developed that cancer.
Oh, that's interesting. So if someone in your family developed it, say, at age 50, you would encourage it at age 40. If they developed it at 40,
but if they developed it earlier, if they developed it, say, if you had a brother who was 43 years of age, then typically we would start looking for the presence of the polyps. The polyps that slowly over time in some cases can turn to colorectal cancer, we would start looking for those polyps earlier so that we could detect the polyps at a stage where they could easily be treated and easily be taken care of.
I think I'm very glad you said that. One of the things I learned in doing the research for this was that the polyps typically grow very, very slowly, which is that one more reason why that early detection, when you are doing it on time, you're catching it well ahead of the game.
Exactly.
So that's a very important message, I think, to get out, that look, there's a reason we're doing this, catching it early.
Exactly.
Maybe down the road.
And it's a lot easier to remove polyps that are smaller and to do the test when it's initially recommended, because the technical removal of polyps that are smaller can be easier for the patient and can lead to a much better outcome than letting these polyps get larger and at times more difficult to treat.
Right. Now, we talked about some of these other potential risk factors like a family history. If an individual has had a history of polyps, certainly that's a risk factor as well.
That's correct.
Is there anything else that, any other risk factors that might make people need to think about this a little sooner?
Special cases. In patients who have been diagnosed with such things as ulcerative colitis or Crohn's disease, they undergo a different screening schedule. For those patients who are in a very select group of people who have a familial polyp syndrome, they get screened differently. But for the vast majority of people out there, the important age to remember is age 50. At age 50, we have the opportunity in patients to detect these polyps and remove them before they become a problem. Studies have been performed that show that this is really the optimal window to do colonoscopy. That is, when the polyps are more likely to form in those people who are susceptible, but when they're at an early enough stage that they can be treated readily. So that's why we encourage those patients who are candidates to go. And really to let people know that in the vast majority of cases, colonoscopy is very well tolerated and really can save your life.
Absolutely can save your life. We have to all just let go of the angst about it, right? Let go of the fear about it and just make the phone call. Just make the call. That's all it takes.
You know, I see patients every day who are very uncomfortable about the prospect of being in the office to be screened. And like I said, in the vast majority of cases, those people who actually took the opportunity to get screened themselves are so glad when it's over. Number one, they've done something to help their health. Number two, they've realized that the procedure and the screenings for colorectal cancer are not nearly as bad as they thought.
Right. Now, is a sigmoidoscopy done differently? That's another screening that I've seen.
Exactly. While they're not done as often as they used to be, my personal feeling is that any form of colorectal screening you have is better than not having screening at all. A sigmoidoscopy is a test that's typically done in the office, that it really examines the lower 1/3 of the colon.
So it's not seeing the entire colon.
That's correct. And like I said, while a sigmoidoscopy is certainly better screening than not having any testing at all, and is probably more sensitive for the detection of colorectal polyps than the testing for blood in the stool.
So it's one notch up, but not quite the
But again, people's individual health problems can be different, and sometimes a recommendation for a sigmoidoscopy will be made by a physician where their particular situation is best served by that procedure.
Okay.
So really the most important thing to remember is that people should consult with their primary physicians to see what test they're probably the best candidate for.
Okay, great. Well, thank you so much.
Thank you.
Were there any other screenings you would like to address at all that maybe I have omitted?
Well, again, basically the ones that we talk about, the first and the most simple is doing the fecal occult blood testing. Okay. That can really be done in the primary physician's office, and like I said, it's the first step that should be done and considered for folks in part of their routine health care.
And the often those are offered in public health centers as well, and health fairs, health screenings that for folks who are still not convinced that this is something they need to be doing and it's not such a big deal, they can at least start there, right?
The most important thing they have to remember is to get screened.
Right, right. Well, great. Thank you both so much.
Thank you.
I would like to just remind viewers that on March 13th, again, there will be a program held at Somerset Medical Center, and Karen, you'll be speaking as well as a fellow physician on the importance of colorectal cancer and how to prevent that. And the program is called Let's Prevent Colon Cancer. Right. We'll have all of that information up on the screen as well. I would also like to thank viewers for watching the program, and in particular, just to take a moment to ask for feedback. This is the beginning of our development of this program, and we are asking viewers to go to our website where they can hear all of this information and get additional resources, which is www.middlebrookhealth.org. But in addition to the information about today's topic, we are also asking viewers to take a minute to complete a survey. And that survey will allow you to give us some feedback on the program, as well as suggest some topics that you may want to hear more about, other important public health issues. So again, thank you both for joining us. And my name is Colleen McKay-Wharton with the Middle-Brook Regional Health Commission. Thank you.
Activity and return forthwith to the origin or to the nearest convenient parallel dimension. Try to imagine all life as you know it stopping instantaneously in every molecule.
Keep good health in the spotlight. Remember to cover your cough or sneeze with a tissue or your elbow and wash your hands frequently throughout the day. These simple actions help keep everyone healthy.